Hey ladies, welcome to GOC Grace channel. We are here again to talk extensively on one of the health issues that affect women. In just a few minutes per day, you can take control of your health and well-being. Remember not to take care of your health on your own. Consult with a doctor for advice. Today we are going to look at bladder control, also known as urinary continence. This is the ability to regulate the storage and release of urine from the bladder. Bladder is an essential part of the urinary system, which includes the kidneys, ureters, bladder, and urethra. When functioning properly, the system allows for the voluntary holding and timely emptying of urine. Loss of this control, known as urinary incontinence, can significantly affect quality of life. Anatomy and physiology of bladder control. 1. The urinary system components. Kidneys filter blood to produce urine. Ureters transport urine from the kidneys to the bladder. Bladder stores urine until it's convenient to void. Urethra transports urine from the bladder to the outside of the body. 2. The bladder. The bladder is a hollow, muscular organ. It can hold 400 to 600 milliliters of urine comfortably. It is lined with detrusor muscle, which contracts during urination to expel urine. 3. Control mechanisms. Internal urethral sphincter involuntary. Maintains continence during urine storage. External urethral sphincter voluntary. Under conscious control. Allows for deliberate urination. Pelvic floor muscles support the bladder and contribute to continence. 4. Nervous system involvement. Autonomic nervous system manages involuntary bladder functions. Sympathetic nerves storage phase inhibit bladder contraction. Parasympathetic nerves voiding phase stimulate bladder contraction. Somatic nervous system controls voluntary sphincter and pelvic floor muscles. Stages of bladder control development. Bladder control typically develops in early childhood. Milestones include infants. Urination is reflexive and involuntary. 18 to 24 months. Begin to recognize bladder fullness. 2 to 4 years. Gain voluntary control and start toilet training. For years. Achieve full daytime and nighttime continence. Delayed development may suggest underlying issues like developmental delays, neurological conditions, or behavioral problems. Types of urinary incontinence. Loss of bladder control can take several forms. 1. Stress incontinence. Caused by physical pressure, for example, laughing, coughing, lifting. Common in women post-childbirth or menopause. 2. Urge incontinence. Strong, sudden need to urinate with inability to delay. Common in overactive bladder syndrome (OAB). 3. Overflow incontinence. Bladder doesn't empty fully. Frequent dribbling, often due to bladder obstruction or weak bladder muscles. 4. Functional incontinence. Physical or cognitive impairments prevent reaching the bathroom in time, seen in individuals with dementia or mobility issues. 5. Mixed incontinence. A combination of two or more types, often stress and urge. Causes of bladder control problems. Pregnancy and childbirth. Weakened pelvic muscles and nerves. Menopause. Estrogen deficiency affects bladder tissues. Prostate issues. BPH or prostate surgery in men can cause incontinence. Neurological disorders. Stroke, multiple sclerosis, spinal cord injury. Medications, diuretics, sedatives, and muscle relaxants. Urinary tract infections cause urgency and frequency. Aging, decreased bladder capacity, and muscle tone. Diagnosis of bladder control disorders. A thorough evaluation includes medical history and symptom diary, physical examination, urinalysis and urine culture, bladder ultrasound, urodynamic testing. Assesses bladder function and pressure, cystoscopy, visual inspection of bladder and urethra. Management and treatment options. Treatment depends on the cause, type, and severity of the condition. 1. Lifestyle and behavioral interventions. Bladder training. Timed voiding to increase interval between urinations. Pelvic floor exercises schedules. Strengthen sphincter and pelvic muscles. Dietary changes. Reduce bladder irritants, for example, caffeine, alcohol, spicy foods. Psychological and social impact. Bladder control issues can profoundly affect quality of life, limitation of activities, fear of accidents, mental health, anxiety, depression, and social withdrawal. Sexual function. Embarrassment or fear of incontinence during intercourse. Support groups, counseling, and patient education play vital roles in coping. Prevention and maintenance. Bladder control is a complex but essential function. Practice pelvic floor that supports physical comfort and social bladder irritants. While problems with bladder control are common, particularly with aging, they are not an inevitable part of life and are often treatable. A multidisciplinary approach involving lifestyle changes, medical treatments, and sometimes surgery can dramatically improve outcomes for those affected. Awareness, early diagnosis, and appropriate management can help individuals maintain independence and a better quality of life. We also advise that it's okay to ask for help and support when you're struggling with any health condition. If you need additional information, don't hesitate to ask. See you on our next post.